The CDC has confirmed more than 100 cases of hepatitis that have been identified in children under the age of 10 across the United States. And this story started right here in Alabama with 9 cases of a severe liver disease in children.
Now, the Alabama Department of Public Health and the Centers for Disease Control are working with medical researchers in the UK and other nations as well to investigate cases across the world. News 19's Kayla Smith has an update.
15 days ago, the CDC issued a nationwide health alert about an investigation underway in Alabama involving 9 children with hepatitis identified between October 2021 and February 2022. Doctors could not find a common source for the cases.
All of these patients were previously healthy, came from different parts of the state, and were hospitalized with significant liver injury without a known cause, including some with acute liver failure.
All of these patients tested positive for adenovirus, a common virus that presents with respiratory or gastrointestinal symptoms. Since the CDC issued the alert, reports of cases have poured in from all over the country. More than half of those reported cases have tested positive for adenovirus 41, which usually occurs in immunocompromised patients.
We also don't know yet what role other factors may play, such as environmental exposures, medications, or other infections that the children might have.
The symptoms of hepatitis include vomiting, dark urine, and yellowing of the skin.
It's important to remember that severe hepatitis in children is rare, even with the potential increase in cases that we're reporting today.
Health officials say the precautions to take with your children are similar to those of many diseases. Wash your hands, avoid people who are sick, and cover coughs and sneezes. The CDC is currently investigating 109 cases of hepatitis in children in 25 states and territories occurring over the past 7 months. More than 90% of these patients were hospitalized, 14% required liver transplants, and 5 have died. More than 200 cases have been reported outside of the U.S. Reporting in Huntsville, Kayla Smith, News 19.
Now, the CDC says a hepatitis outbreak is difficult to track. That's because there's not a mandatory reporting system. Instead, investigators have to rely on voluntary reporting to identify these cases.